In recent years, advancements in hysterectomy techniques have been hailed as major medical breakthroughs, promising less invasive procedures, quicker recovery times, and fewer complications.
Hysterectomy is the commonest gynecological surgery which a woman undergo for various reasons like fibroid uterus, adenomyosis, abnormal uterine bleeding, and cancers sometimes. So this is the most commonest one, and the various approaches for hysterectomies are like from older to the newer modalities in that order is open hysterectomy, which we used to do before. So in that, the 10 to 15 centimeter incision was given on the lower abdominal wall and the uterus was used to be removed. But with the advancement, we have various modalities like laparoscopic assisted vaginal hysterectomies, total laparoscopic hysterectomies. Nowadays, robotic assisted laparoscopic hysterectomies have also come into view. Now, so the various approach depends upon the diagnosis of the patient, and then we select the patient and do the surgery.
When considering a hysterectomy, selecting the most suitable technique is crucial for ensuring the best possible outcomes for each patient. The choice of techniques depend on several factors, including the patient's medical history, the patient's personal preferences, to name a few.
The cause or the diagnosis of the patient is the foremost to decide on the surgical procedure. So suppose if it is uterine prolapse in which the uterus comes down through the vagina, it lies down into the vagina. So the best approach would for that patient would be a vaginal hysterectomy. In vaginal hysterectomy, the natural route, that is vagina, is selected to remove the uterus, and this is a kind of scarless hysterectomy. If suppose the patient is suffering from large fibroid which you cannot approach through the vagina, in that patient, laparoscopic hysterectomy is the most advised type of approach, because in that case the size of the incision is very small, like between 5 to 10 millimeters in size, and the post-op recovery and post-op pain and blood loss and the chances of infections are very less with laparoscopic approach. Where the facilities of robotic surgeries are available, the robotic assisted laparoscopic hysterectomy can also be done in such patients.
When it comes to undergoing a hysterectomy, the decision is often complex and fraught with anxiety. With the advent of the latest techniques, such as robotic-assisted surgeries and minimally invasive procedures, patient may feel overwhelmed by the options and the promises of improved outcomes. But discussing with your doctors can give you clear insights.
I would advise patients to discuss with your doctor in a thorough manner that what is the indication first of all, whether it is absolutely indicated or not. So if it is absolutely indicated, then yes, you are going to get relief completely, like 100%. But if there are certain other ways by which you can conserve uterus, then that approach to be followed first. So this has to be discussed with your doctor. Secondly, along with hysterectomy, whether to remove ovaries or not is a very important point to be discussed, because oophorectomy or ovarian removal has certain side effects, because we know that ovaries are the source of hormone and it is very important for the health of the heart, the health of the bones to the patient. So the removal of the ovary along with uterus has to be discussed before undergoing hysterectomy.
While advances in hysterectomy techniques have undoubtedly brought some benefits to the field of gynecological surgery, it is crucial to critically assess their hidden downsides too.